Alright, so for the next species of organism which we'll be looking at is what is known as what? Clostridium septicum. Septicum. Alright, so you can see this one is rod shape. So that Clostridium septicum is what? A gram-positive, spore-forming anaerobic bacterium. So it's usually part of the normal flora in the gut, right? So it's like normal bacteria that is found in your gut, okay? So if we're talking about it and saying that it also can cause problems or diseases, or that means if it is a normal part of you, it will only cause diseases if your immune system is now below standard again. So that's how I think. So for the domain of this organism, so that the domain is bacteria, phylum is Bacillota, class is what? Clostridia, order is what? Clostridiales, family is Clostridiaceae, genus is what? Clostridium. Then the species now is what is known as what? Clostridium septicum. So for its description and significance, so that the Clostridium septicum is what? An obligate anaerobe. So it can actually survive in an environment that there's no oxygen or even low oxygen, right? So it's rod shaped like I was telling you guys, and can form spores that are highly resistant to heat or any adverse conditions, right? So the spores can actually survive in dormant state. They'll be there for a very long time till they now found a suitable environment to start germinating. So we say that it is actually known for causing gas gangrene, that's myonecrosis, which is a severe potential life-threatening infection, right? So unlike other Clostridium species, this Clostridium septicum can cause gas gangrene without the need for trauma at the infection site, okay? So the infection is thought to spread hematogenously from the gastrointestinal tract. If it infects your gastrointestinal tract, it will spread through the blood and can go and cause gas gangrene somewhere. So for clinical relevance, we've spoken about gas gangrene. It can also be involved in sepsis, where you're having bacteria going into the bloodstream, which is known as what? Bacteremia. So it will cause sepsis. That's when your whole body is now responding to a toxin or so. So treatment is if there's a wound, you do surgical debridement. Then since it's a bacteria, you can now give what? Antibiotics like what? Uh, penicillin and clindamycin, right? Then sometimes, since it doesn't really like oxygen, you can now do hyperbaric oxygen supply, where you give a lot of oxygen to the site of infection and the organism might die, right? So prevention involves proper wound care, especially in individuals with underlying conditions that predispose them to the infections. If you have a wound and there's a likelihood of developing infection, then there should be proper wound care. Alright. So I think basically that's it for Clostridium septicum.